some people, drinking alcohol is just a bit of fun, but for others it is a need, an addiction. Government has banned the sale of alcohol and cigarettes during the 21-day nationwide lockdown. Now, this leaves addicts in a desperate situation. To speak about the withdrawal symptoms, Mark Lockwood from the Addiction Psychology Specialist from Pathways Private Drug Rehabilitation Centre joins us. What is it that they're going through, Mark?
Well, it's tough times if you're addicted, especially to alcohol. Obviously, there'll be a withdrawal period. And alcohol is one of the most dangerous withdrawals that we can go through. You can have a psychosis, and it can, of course, be deadly. So obviously, it can be quite something that's quite dire, and you definitely need some clinical help if you are an addict. But having said that, that's for a very, very tiny portion.
Yes, just explain to us how bad it has to be in that sort of situation. I mean, is that just a sort of traditional alcoholic, or what are the other factors at play there?
Well, I mean, first of all, I suppose I think the latest studies are about 10 to 15% of the population fall into the addiction category. And a chronic alcoholic like that, we're probably looking at a very, very small number, between 1 and 2%. So, the withdrawals will be for a very, very small amount of people on a chronic level. So that would be physical withdrawals, where your body can actually go into a kind of a shock. But for most people, it will just be uncomfortable. It will just be a period of not being able to soothe the body, mind through using the alcohol. So it's more uncomfortable for 99% of people. But the 1% where it hits the body, that's where it can be dangerous.
All right, so what can we do for them?
Well, it's obviously you've got to consult your doctor. Obviously, you need to call first. For the physical side, once you've taken care of that, which is normally about a week, a couple of days to a week, where you can be hospitalized, put on a drip. And then after that period, it will be the emotional and psychological side, which takes much, much longer. And for that side, for the most part in South Africa, we don't have much in terms of free drug rehabilitation or alcohol rehabilitation. But we do have community meetings from Alcoholics Anonymous, Narcotics Anonymous, and a ton of those are actually supplied online at the moment.
Mark, is there a traditional tipping point for people, or does it just depend on who you are? Because I know a lot of people will see this period, those who think that they might have a problem, as possibly a time in order to deal with that sort of problem. So is it a different solution for everybody, or one solution fits all?
Absolutely, it's a different solution for everybody. I think during this period, people obviously go home. They're used to self-soothing, and that would be more of a habit than an addiction. You actually believe that alcohol, nicotine, things like that make you relax, but they actually have the adverse effect. They don't make us relax. They increase our heart rates, blood pressure, and cause a ton of problems physically and emotionally for us. So during the time, it's actually to be able to, define it, that it is a habit or an addiction, and then to obviously use healthier ways. There's healthy and negative ways to try and soothe yourself. So you switch out the negative ways, cigarettes and alcohol, with healthier ways of learning how to relax.
Like what? Meditation, exercise?
Absolutely.
All that kind of thing. And at the same time, it's not just alcoholics, but you've got people who've got a problem with drugs. What sort of access do they have to help?
Not much, unfortunately, in South Africa. We do have, a couple of volunteer programs, and we've got a couple of state programs. But, I mean, the problem far outweighs the solution. So there is a dire shortage of help. But people have definitely stepped up during this time. You'll find meetings. A lot of counsellors are giving sessions for free online. And then obviously all the big groups like NA and AA are providing daily morning, noon and night meetings. So those meetings are designed to help people sort of connect with other people going through the same thing. And they definitely, I mean, the one thing we know about AA and NA is they do work. So, we've had about, a couple of million people through that program since 1930s. And the program works. So a lot of people are starting to connect, sir, from all over the country that haven't done so before.
Okay, so your message for people who are struggling is to connect with the bodies that are out there. And very quickly, do you want to see this ban on alcohol and cigarettes lifted?
I think it's, to be honest with you, it's not what people want to hear, but it's neither here nor there. It's, at the end of the day, it's just alcohol and cigarettes. Now, we know that the long-term effects are highly adverse. There's warning labels on both those products, and that's for a reason. They don't just put those warning labels on alcohol and cigarettes. So I think it's a good time to take a break. In the UK, they do Dry January, which is a 30-day stop-off, and it's very, very popular. So why not look at that in these terms here? We take a break. It's just alcohol. It doesn't provide any nutrition, anything like that, except for the chemicals in the brain that tell us it's trying to relax us. So if we can find different ways, I think we should go through it and go with it. And we'll reap the benefits of it. You'll sleep better. You'll be more relaxed. And there's a drove of health benefits from it.
As you say there, bit of a no-brainer. Mark Lockwood, good to talk to you. Thank you very much. Let's take